everyone. Welcome back to Mom Meets World. I'm Anjali, founder of Radiant Heart Center VA. I do one-on-one, so check me out.
And I'm Kathy Desai-Seltzer, owner of Vyana Infant Massage. I teach parents how to massage their baby for better health outcomes. And today,
we have Dr. Andrino Flevotomos with us. He is amazing. If you live in Arlington, you know the name Andrino. I have had personal experience with my second pregnancy, and I joked that I wanted a third just so I could do chiropractic work through the whole pregnancy.
And if you've been following along when we interviewed Lindsay Vick, who was my doula, she was the one who mentioned Andrino in her interview, but also was the one who recommended him to me when my baby was breech. So we are so excited to have Dr. Andrino to learn all about chiropractic and how it can help pregnant women and new moms.
Yes.
So let's get started.
Let's get started. So Andrino, can you tell our viewers what you do?
So the overarching goal is to improve birth outcomes. I help people have easier, faster, safer births. Each person's different. You may have someone that comes in and they have a fetal malposition, so that becomes a priority. Or maybe someone is already in labor and they've stalled and they need help getting things going. But generally, what you're trying to do is make sure that people have a better birth outcome.
Yeah, that's a great mission and a great career to have, right? So what led you to this work? What was your story?
So I was in chiropractic school, and one of my professors, who was the go-to person at the time for prenatal chiropractic, he essentially forced it on me. And as I started doing it, I realized that I did have a natural sort of talent, so to speak, when it came to it, and it felt very natural to me. A lot of people are uncomfortable working on, prenatal patients. For me, it just felt so organic. And then I fell in love with the work. And once that happened, I was hooked. And over the years, I've been able to discover more and more nuances that, each little one may improve the birth outcome a little bit more, and in the aggregate, you start having these reproducible, positive outcomes. And I'm so immersed in it at this point that I couldn't imagine doing anything else.
Yeah, I came in with Luca. Marilee I asked my midwife if there's one thing that I could do, because I was 41 weeks. She goes, go to a chiropractor. So we went together, and as Jeff was paying when we were leaving, I was like, okay, the baby's coming tonight. And we left because my pelvis was tweaked.
Yep.
Oh, that's amazing.
Yeah. To avoid getting too technical, but just to give an idea of what we look for and the sort of philosophy behind the work, you have harder tissues and softer tissues. Softer ones are going to be all the ligaments and muscles and tendons and the uterus, actually, because that's all muscular. And then you have the bony structures. So the bony structures will dictate how much space the baby has, and also, to some extent, your comfort during your pregnancy. And the soft tissues will dictate fetal positioning, the ease with which the baby can descend when time comes, the likelihood of you going to labor of your own volition, because the baby's head should be intimate to the cervix, and there are ways to encourage this. Otherwise, they stay too high and you wind up not going into labor on your own. And so you're always looking at all of those components, making sure that they're all just right, all the way through the pregnancy. I like to use the analogy of training for a marathon. There are some people that could lay on the couch for a year and get up and complete a marathon without dropping dead. It's possible, it is. But it's not suggested, right? The best way to do it is to have the proper, coaches to sort of help you prepare for this, so that you can do it with ease and in a way that we know, the ultimate outcome is going to be favorable.
There's a stigma to chiropractic work, and like you were saying, there are a lot of people uncomfortable working on pregnant women.
Right.
Can you share some common misconception about?
Yeah, definitely. So I myself have had a lot of trouble finding someone to take care of me, chiropractically. The blessing and the curse of chiropractic is that it's so diverse. So you could have the scope is so broad. that you don't know what to expect when you walk into an office.
Yeah.
You may go in and they could wave crystals over you, or you could go in and they could have all kinds of, it could be totally mechanized. You may never have a person's hand on you ever. It might be machinery and gadgetry and so forth. And so the fact that they don't really have a standard of care that's followed to any extent. I think that's one of the reasons why, it's hard for people to sort of accept it, because they don't know what they're accepting. You have to have a really clear-cut identity for people to become familiar with, and then decide, whether or not they want to do it. But, you could have one person that has a certain experience, they share that experience with someone else, but doesn't mean they're going to have the same experience.
Right.
First of all, because they're a different person. But secondly, we don't know whose office they're going to walk into. Chiropractic schools have become very much concerned with their students having the same training as medical doctors, which is fine, because you want them to be able to discuss intelligently if they have a mutual. I mean, I just speak to obstetricians all the time, and you want to be able to speak the same language and make sure you both understand things. Plus, you might find something, because chiropractors have an opportunity to see things before other people will. You see their skin, you may notice a skin lesion. If you haven't studied, dermatology, you're going to miss that, and that might be a crucial point. Time may be of the essence. Or, for example, I had a patient very recently was unable to lay on the table, and she explained to me that she had unilateral breast discomfort. And I did a breast exam, and there was a mass, and I sent her for an ultrasound and a fine needle aspiration, and she has a very aggressive type of cancer, but they're treating it. But her next mammogram wasn't scheduled for, she's young, so we don't know when that would have happened. So I understand their reasoning for wanting the chiropractic students to know all the sciences that other health practitioners learn, well, other doctors anyway. But in doing so, they have removed a lot of the chiropractic part. And so they learn very little chiropractic now, and a ton of stuff that you do not use on a daily basis. And so when they come out, they don't have the tools, and they have to find some other method of acquiring knowledge, either by working under someone or by taking continuing education classes and constantly learning, which I do. I'm constantly learning more stuff, but there needs to be at least some core elements that are in place for every practitioner. And then if you want to learn ancillary stuff, that's totally cool, but you have to have the core skill set, because, prenatals don't stay prenatal. They go back to being CrossFitters, they go back to being marathonists, they go back to being whatever. And even if you're, an excellent prenatal chiropractor, that technique is distinctly different from regular chiropractic. And you have to be able to now transition to other types of care. And, that requires time, study, and practice. And, you want the practice to be before they're unleashed on the public, not not coming out and then figuring it out as they go along.
That's really interesting, because when I first started chiropractic, it was 2003, and I was going for headaches. I didn't know that chiropractic could help with headaches, and it did. And so I've seen maybe in the last 16 years, half a dozen.
Right.
And each of them have been very different and
Right.
unique in their own style. And so I think there is maybe not that consistency you're saying is good. But it's helped me so much, and it's something that I do now just to maintain health. Even after baby was born and we went through all that now it's just to maintain health.
Right. Yeah, it's just like dentistry.
Yeah.
There are some people that are going to wait until they have an abscess tooth that's about to kill them before they go in. There are some people that are going to do that, but generally you're encouraged to go in for, cleanings and regular routine x-rays and maintenance, just to make sure everything's fine. Or like a car, human body experiences wear and tear, exercise, taking care of children, etc.
Sitting all day.
Yeah, sitting all day, exactly. It's a stressor on the body, and the body needs maintenance. So when you adjust someone, there is a biomechanical aspect to it that you're correcting, but the neurological implications are the greater part of the work. because every time you adjust someone, you are actually sending messages to the brain that will change.
The chemistry.
Yeah, your neurotransmitters change, hormones can react to it depending where you've adjusted. The brain then has a new concept of where the body is three-dimensionally in space, and it starts making corrections on its own. So the neurological implications are really, the most important part of it, because you may find someone one day that has two small misalignments. They might not have a whole lot going on, but one of them may go to, may be the bone that's, adjacent to the nerve that goes to the large bowel or colon, and you might adjust it. This person will call you 2 days and tell you that they've been constipated for the last 10 years, and now suddenly they're having increased motility. So, you don't have to be a complete disaster to benefit from it. You want your nervous system working properly because your brain controls your body. You want it to be able to communicate with it and receive messages from it, more importantly, effectively. They've done stuff like this, like they've done experiments, unfortunately, on animals a long time ago. They'd move bones out of place, bladder would become irritable, the heart rate would become arrhythmic, all different kinds of things, and it would always correspond with wherever those nerves went. So even during a night's sleep, theoretically, a person could have some bad sleep hygiene, and develop chronic visceral issues that they don't even know is related to that.
You just shared a lot about misconceptions kind of chiropractic work. What do you want pregnant women to know about how it can, and you talked a little bit about it, but specifically to pregnant women, how can chiropractic support throughout the pregnancy help in different stages?
Right. Okay. Yeah, I like this part. So when you're pregnant, your body becomes entirely different than it was beforehand. Relaxin hormone makes your joints incredibly loose, where simple, even sitting like this, for example, could produce symptoms because your pelvis is so loose, and it loses a lot of its integrity. There is a reason for it. It actually encourages your body to be able to house, the baby more effectively, but there's a consequence to that. You could wind up having different kinds of conditions that you normally would not have. So throughout the pregnancy, the first thing you want to do is make people be comfortable. Because for me, I don't practice strictly objectively. I practice subjectively too. So so even if somebody's pelvis doesn't look that bad, if they have a discomfort or something, I like to take care of that. I want people comfortable during their pregnancy. So there's that aspect of it. And then there's also, you're creating new patterns in that person's body all the way through their pregnancy. The whole purpose is to constantly put input into the body that the brain will pick up, so that by the time they have that baby, the brain has already accepted this is our new normal, right? Because they may have some patterns that they've developed over decades that you now have to undo to make sure they have a quality birth. So that's largely what you're doing. You're making sure of that, but you are also taking these small little things that pop up, and there are quite a few. Pain, SI pain, pubic symphysis dysfunction. Some people will tell you that they start to experience hormonal headaches when they're pregnant. They might tell you that, they've got mid-back pain that they never had before because the belly and the breast tissue has become so much heavier that it pulls everything forward. And there's a lot of stuff like this. So you want to take care of that also, but by and large what you're doing is creating new patterns so that prior to even getting to their due date, they're already, perfectly set up for a vaginal birth.
And you've mentioned a few of them, but what are the most common challenges that you find your patients coming in with?
Experiencing themselves?
Yeah.
So SI pain is the most common.
Okay.
That's when you have, it's sort of like a pain in the lower back. It'll be on one side or the other or both. And they'll feel it mostly when they get in and out of chairs. That's all day long.
Yeah.
The next one is Piriformis Syndrome. People will refer to it as sciatica. It's really not sciatica. It's called pseudosciatica. And I kid you not, it used to be called pregnant lady syndrome. I kid you not. It's when a muscle, it's when the pelvis expands, causing a muscle on the side of the glutes to contract to stabilize the pelvis. And when it does that, because the sciatic nerve happens to run underneath that muscle, it presses on it, and you start to have it feels like a toothache in your butt. That's exactly what it feels like a raw nerve in a different location. And that's probably the second most common, and that you can eradicate very easily, and it's very uncomfortable. I actually myself have had it.
So that's how you know what it feels like?
Yeah.
Okay.
I bought a car that had a seat that for some reason causes me to have this, and for that reason my wife drives whenever I'm in that car. That's the reason. Yeah.
Oh.
Yep.
You didn't get rid of the car, you just changed seats.
Yeah, just changed drivers. And it wasn't the intention. I didn't work it out that way at all. And then the next thing you will see is pubic symphysis dysfunction. This is a really common thing. It's a type of pubic pain that's it's intractable. When you have that, like, it will interfere with every aspect of life. If you already have a toddler and you're pregnant and you have this, it can preclude you from caring for your kids. So it's really important to deal with that. So we see that a lot. And then, fetal malpositions. That's a big reason why people come in. Unfortunately, sometimes they come in at 39 or 40 weeks, which, still have decent success, but it's not the best way to do it. It's easier to prevent a kid from getting into a malposition than correcting it once it happens.
When is the ideal time to?
So I don't see people with great frequency, because if you're doing quality work and stuff and the person doesn't have any kind of acute issue, you really don't have to see them a lot. I don't know, 18, 20 weeks is a good time, but you might not see them for 4 or 6 weeks after that.
Yeah.
You just want to get that initial stimuli into the nervous system, let the body do its thing, and then, as you get closer to the birth, the visits get closer. That's sort of a red flag too. If you go to prenatal or any chiropractor, they have you coming in like, we're going to see you 3 times a week for the next 2 weeks, and then 2 times a week for the next. It's excessive. It's excessive, and I see this happening all over the place. So, of course, if someone fell off a roof or something, they had a major acute injury, but frankly, if you're seeing them that frequently, they probably need,
surgery.
They might, or pharmacological. I can't imagine a circumstance where I'd have to see someone 6 times in 2 weeks. It's almost impossible for me to even imagine.
Okay.
And so you were talking about how chiropractic work impacts kind of the neurological signals that are being sent to the body, and how through pregnancy you're sending the messages to help the body adjust to this new size baby.
Exactly.
How important is chiropractic work postpartum?
Yeah, so getting put back together. I have always felt, everyone focuses on the birth, and then secondarily they focus on the pregnancy. I think the 4th trimester is
Yes.
That's the one.
Years, like, for the 4th trimester, yes.
I think that is the one that really does the most biomechanical and even psychological damage. So that's the one. So every stressor brings you closer to reaching that threshold beyond which you lose your mind.
Yeah.
So you want to remove any stressors you possibly can, and the biomechanical ones are easy. So postpartum, we like to keep. Nursing it's such a physically, even though it's such a natural thing, some of the positions feel so unnatural. And I think that's because we're using chairs and we're using, I don't know if it would be different if we were like nursing side lying on the dirt.
Right.
But maybe yes. But in either case, we see there are a bunch of conditions that are associated directly with nursing. And I rather take care of someone before that even happens, because once they do, they come in, I can tell that they haven't been sleeping, they look uncomfortable. And, no one wants to experience that when they're taking care of a newborn, because those babies can feel like your energy, and if you're suffering through it at some level, I gotta think that they're feeling that vibrational frequency, or whatever you want to call it, and I don't know that it impacts them in a way that you'd want them to as a mother.
Right,
for sure. Yeah, I think we can all attest to having nursing issues.
Yeah.
Oh my gosh, the back pain is so real.
Yeah.
Well, and I think it's this idea in our heads, like, oh, we need to make baby comfortable, so we do all these crazy things instead of just saying, this baby is so malleable, they can adjust to whatever position we put them in.
Right.
And spare.
But they have very little control over a baby's head compared to the strength of their neck muscles when they're born, I mean, even for the first like 3 months, that would be like, you know, putting a Fiat on my neck or something like that. No, I was actually looking for a huge piece of furniture, but because I mean that's really what it's like. And so just for them to like move their head a half an inch to get to the boob, they're using muscles that they've not engaged really before, and so making it ergonomic for you and less stressful for them is absolutely a challenge. And you'll see people that have had multiple children, they master this, and when you see them you're like, she's like making it look very organic. How's that possible?
Yeah.
It's a skill set that's developed over time. I think it's even a perishable skill, because I've seen people that had kids very young and then had children later on in life, and they look like, you know, they lost. And I was like, don't you remember how to do this? And they're like, I don't. Yeah.
I was going to ask before I forgot.
Yeah.
I asked about postpartum for mom. What about baby?
I was going to ask the question.
Yeah, so with peds, I mean, peds don't need a lot of care, but they should really be checked after the birth. One of the biggest things for me, and I never bring this up with my patients, but there has been a study with small number of cases, because most parents, this is too sensitive to really get them to participate in, but there is a working sort of hypothesis that misalignments in the upper cervical area actually lead to SIDS. And the way that they describe it is that the segments in the upper part of the neck are tethered to your brainstem, particularly the part of the brainstem that controls, it's called the vasomotor center, and it controls heart rate and respiration. So if a baby's brought out and the head is turned at some point, which often is the case, and that same child happens to turn their head in a way that's in opposition of however they were misaligned, it will prevent blood flow to that part of the brainstem, and it can cause some kind of, it can cause fetal demise, unfortunately. And so my big, because I've seen some massively misaligned infants, and so I like to check them right away at the actual birth if possible. And that's always my biggest concern. After that, it's going to be, do they have torticollis? Is that going to affect nursing? Is their jaw recessed, which prevents a proper latch? All of these types of things. If they have a baby that's colicky, if they're prone, if they have other siblings that are sick in the house, you want to keep that young child's immune system boosted, because they've never encountered these antigens before, and so there is a close link between the central nervous system and their immune function. So we do it for that purpose also, to make sure that they're able to withstand the exposure to these various pathogens.
And it's not painful for them.
No, not at all. So there are a couple of different ways you can do it. You can use an instrument. The instrument, the amount of force, actually how I test it, you guys know this, I actually put it on my own eyelid and do it, because it's not my hand, which means I don't have any tactile feedback. So in order for me to know for sure that that's safe for an infant, I actually put it above my eyelid, and because I was thinking what the most sensitive area on my body could be. And as long as I can tolerate it on my eyelid, then I know it's safe for an infant. That's how I do it. And I know it looks ridiculous, but
it's so funny to see my older two have been in there when he's testing it for the baby, and they're like, what is he doing?
Yeah. I mean, until someone has a better method, that's how I'm going to do it.
Yeah.
And you do it by hand. It's very gentle. They fall asleep while you're doing it sometimes. If you use a machine, a little mechanized tool, it's close to their ear. So if you can, they're sensitive to sound sometimes when they're small. So if you can cover the ear, it makes it a little bit easier. But sometimes if they're very sound or stimuli averse, it could get their attention. They could cry a little bit, but it's absolutely not painful at all for them. And they generally will fall asleep that night. And so,
sleep really well.
Yeah, because it actually stimulates the parasympathetic nervous system, which has to do with healing, digestion, relaxation, and it decreases the sympathetics, which is the fight or flight part of the nervous system. So when you first do it, it's a new experience. Their sympathetics will peak a little bit, but then they come down and the parasympathetics start to become dominant. And you want a kid that's in parasympathetic tone. Those are the children that are chill, they're relaxed, they sleep well, their bowels work properly. So that's the other benefit of it.
So what advice would you give to someone who is pregnant or a new mom and is considering chiropractic?
Schedule it now if you think that you're going to be pregnant, because Chris Andrino's wife has the books and he is a busy man.
Yeah, get it. Call as early as possible.
Right.
Yeah, call as early as possible.
It's like a preschool. Just if you think you're going to try to get pregnant.
Not just that, but actually how to pick a proper prenatal chiropractor. So the first thing you want to do is make sure that they are Webster certified.
Okay.
But I will be frank with you. Webster, for most providers, is a weekend seminar. Okay? And at my school, it was invented by a guy that was at my school, a guy that went to school there, and it spun out of a technique that my university was based on. So we learn it all the way through.
Okay.
You know, you're doing chiropractic, you're there for 4 years, you're exposed to this right at the beginning. The technique that it was based on and Webster, you learn before. When you graduate school, you already have learned more about prenatal chiropractic than you could learn in that Webster class, which I have done. When I went and did it for the certification, it was like my first month in chiropractic school.
Wow. Okay.
So,
at least have Webster.
yeah, at least have Webster. But, I think, part of the problem is that everyone's provider is the best, right? If I ask you, about your dentist, you'll be like, my guy's the best, my guy's the best. Everybody, so it's hard. So you always want to rely on something a little more objective than that. Look at their history. Like, you want someone that's experienced, because this is a technique that you can only improve over time. You cannot study this for a short period of time, intensely become a master. It's not like that, because the nuances are too great. So you don't want someone that's brand new out of school. I wouldn't want someone that's brand new out of school. And the other thing is, sometimes it helps if the person is, respected, has good relations with other birth professionals.
Yeah.
That's true.
If there are 10 midwives, if you meet 10 midwives and they mention the same person's name and doulas say, oh yeah, go see this person, she's great or he's great, then that's going to mean something.
Right.
Lay people, they don't really have a reference point. Their experience may have been great, but they don't have a comparison. Birth professionals have worked with multiple providers, so they know what's the difference between one to the other.
Yeah, that's a really good point.
Yeah.
So can you summarize for our pregnant women or fourth trimester postpartum mamas why chiropractic?
After they've had the baby.
Well, either for pregnancy
okay.
or just why do you recommend chiropractic work?
Okay, so prenatal chiropractic, better birth outcome, more comfortable pregnancy, and it's going to keep you sane once you're in the fourth trimester.
Those are enough.
That's just it,
Amazing summary. So hopefully you live in the DMV area because you want Andrino. Otherwise, good luck. Call his office and maybe he can recommend someone.
Which I do. If someone lives somewhere and they contact me, I actually will call providers. I know the right questions to ask. So I will call on their behalf, and they give me their zip code.
Awesome.
And I actually will find people for them, and I'll ask them, and then I'll give them, effective feedback, letting them know, yeah, I feel like comfortable with you going to this person. Yeah.
Awesome. So even if you're not in the DMV area, you're calling
Taken care of.
Andrino's office. You can follow us on Facebook, Instagram, Twitter. You can find Andrino's information and our information below. And as they say, there ain't no hood like the motherhood. Bye. Thanks for being here, Andrino.
Thank you.